Clinical visit. All right, so your patient is now checked in. Please see the video on filters to see how to design your filters to find out when your patients are actually here. My filter, I have, again, the single select button. So whenever I click on a patient on my list, it will go directly to their chart. So in my case, bound test is here. I'm going to click on that patient, and we're going to start working on our note. Okay, flags will usually pop up. You should read them. Most of them you'll see you can usually ignore. In this case, refill requires appointment. This patient will not be able to get refills until they are seen because it's been usually over a year. Ignore the age. This is a test patient. So this is the face sheet. Please see the video on face sheet to see how to generate the information in this. So this is an established patient. Okay, so we are going to create a note on this patient. So we go over here to create note. And in our case, we're going to write a progress note. So different types of notes here. Correspondence notes you don't generally use. Custom note you don't generally use. H&P note usually used for a new patient. MISC note you use, and you can usually free text stuff. So I'll just show you, for example, MISC note. Patient needs an appointment. You can type stuff and you can save it. We're going to close out of that for now. All right. Orders note is when you actually want to order something like antibiotics or labs for a patient, but a patient is not in the office. Procedure note is generally done by our technicians whenever a procedure such as an ultrasound or urodynamics are done on a patient. You'll also frequently use them when you do procedures at one of our neighboring facilities. Progress note is what we normally use. Quick note is a easy way to get a minimal progress note if you're doing a low-level visit. And triage notes we don't generally do. In our case, we'll actually do an H&P note. We'll pretend that this is a new patient. All right, so you have two options over here. If the patient is not a new patient, you can import the last note, assuming that you are happy with the last note that was done. And you would click over here, Import Documents. Very importantly, you want to determine which component of the last note to pull in. I recommend that you do not pull in the physical examination or vitals or results. Okay? And really drawings. We don't really do drawings in our practice, but the chief complaint, HPI, review of systems, kind of a plus minus. You may want to not pull that in. An assessment and plan. And the reason I'll pull these in is because the assessment and plan I will alter for what the patient is there for, especially the assessment plan. You could probably get away without checking the box. Okay, and it is very important to know that when you pull notes in, you do need to alter all the components in order to remain in compliance and to make sure that it is an original note for the patient's visit. So, for example, I'll just show you over here. We'll pull in this progress note. And it pulls in the sections that I checked off. And so this is the patient's last progress note. And as you can see, the physical examination did not go in. I think the review systems, I did have it go in. And that's how you do that. So in our case, we're going to use the template that we pulled in earlier. We're going to close this. You were trying to leave this page without saving your changes. Yes, that's fine. We're going to start again. All right, so we're going to pretend this is a new patient. And we're going to select our template. In our demonstration, we're using this base template, which is an older template, but is pretty comprehensive for most urologic problems, although some areas are definitely in need of an update. So let's say patient bound test is here for stone disease and voiding dysfunction. We'll check those off. If we wanted to add a chief complaint, if for some reason it's not in our template, well, first of all, we could always add it to our template later on, which we'll go over. We briefly went over it, but we'll go over again in a later video. If we click over here, add new chief complaint, we'll just add renal mass. I think that's already in there, and that will add another complaint to this. Okay, so as you can see, all these sections go one by one, and usually it makes sense to go through them one by one. So this is our typical HPI. Okay. Um, they follow the AUA symptom score, and they follow the exact sheet that every single patient fills out in our office every single time. It is designed to get the full points you would need for a high-level visit for the history. But again, see our separate coding and compliance lectures to determine what you actually need in your note. So we click through this. Anything that you see over here in blue are areas that can be clicked through. So, and you want to make sure that the grammar is normal. But this patient is A, so we'll click over here. So anytime that you see on this list a star, that means that there's more stuff to put in. If the patient is actually here for a follow-up visit, we can click that, and it'll get rid of some of the other stuff. But let's say this patient is A. Referring care provider. Now, usually the kiosk will put this into the chart, but let's say it didn't. So we're going to say that this patient was referred by Dr. Smith. We'll just put this doctor's name over here. And then these 0, 1, 2, 3, 4, 5, these corresponds to the list that the patient fills out. So we'll say 2, 2, 2, 2, 2, 2, 2, 2. We'll say the patient is unhappy because they're seeing us, and we'll just say the AUA symptom score is 14. Okay. We'll say the patient does not have hematuria, has been having dysuria, and has been having pain in the. So here's a multiple select screen: kidneys and bladder. The patient has had studies. Let's say that she's had a CAT scan, CT urogram. We reviewed the report and the images, and the report the findings are below. And the patient has had labs, and again we can choose multiple things. And this is how the note ends up looking. Now, obviously, this is pretty generic. This does help you get all the points that you need for the history, but I would recommend you can add a sketch pad. And for example, we said that the CT urogram from, let's say, 716, no stones, cysts, or tumors. PSA 716, 0.3, UA 716, negative for blood, nitrates, glucosidesterace, and we'll actually, you can put a little bit of narrative in if you like. Patient has had dysuria for the past 5 years, has seen 3 other urologists, and as you can see, there's spell correction over here. Sometimes they'll change it automatically for you. If you put in, let's say, well, maybe not. So some things it will change automatically, but if you right-click on any of these, it will make a suggestion for you. Anytime that you see a red thing underneath the word, usually means that there's a spelling error. Okay. And so this is, again, added a sketch pad, has seen 3 others, and has tried oxybutynin and Vesicare. Okay. And these tools over here are pretty self-explanatory. You can actually, if you wanted to, you can draw something. But we don't generally do that. But sometimes if you're describing something, you can do that. All right, PFSH, past medical, family, and social history. If you leave it blank, nothing shows up in your note. Very important, if you just added stuff to the face sheet, click on this Update History to pull in the new history. I'll show you an example. So B is a basic display of historical findings. That's my favorite way to list things. And if you're doing a history and physical for a surgical procedure, you will need to pull in the history. C is a complete history. And really, a lot of this is redundant, and it kind of, unless you have the exact dosages in for everything, it kind of takes up a lot of space. R, review is none reviewed, none changes. Changed, if you're doing a follow-up visit, that's probably a good thing to do. And you can say no past medical history. I never use this. So B. So for example, if I go back to the face sheet, and let's say I'm going to add let's say I add that the patient is now allergic to penicillin. So I'm going to remove this from the patient, and then I'm going to add penicillin. Not sure if that penicillin. So if I want to pull that back in, I'm going to click Update History, and penicillin is now on the allergy list. Okay. Review of systems, again, go to the coding lectures, whether or not you want to use this, but total pulls in the total complete HMP based on the ROS part of the patient sheet that the patient uses. C and H is basically CHPI. T, I believe, to change anything on the on the ROS. So basically, you click over here, and then you say the patient has hearing loss and tinnitus. You have to click over here. Integument. Let's say the patient has hirsutism. That gives us C. If you go to C, everything goes back to what it was. Everything gets negated. Go back to T, it goes back to where we were before. Vitals, we don't currently do. However, in some cases, we have done them in the past, and you would click over here, Add Select Vitals. If you want to do, you would add new vitals, you could put in. Interestingly, the kiosk will actually pull in the weight, height, and will calculate the BMI. That's actually important for the surgery centers, as patients with a BMI generally over 40 cannot have surgery, certainly a sleep surgery at the surgery center. So that's something that you do need to look at from time to time. But we'll put in this patient's vitals for whatever reason. 60. All right. Physical examination. All right. If it's a new patient, you'll probably want to do a new patient exam. In some cases, you may want to use one of these other templates, though. Follow-up is what we generally do if you're not doing a genital exam. Male genital is as it sounds if you're evaluating the testicles and penis. Pelvic exam is if you're doing a digital rectal examination. For this patient, so we'll do a full level 5 exam. And again, look at your coding and compliance lectures to understand the examination. How do you change? So let's say we did an exam and the patient is obese. We'll click over here, Appearance. We'll click Large Body Habitus. Okay, we can, let's say the patient sclera, we'll say icteric. It's a female examination, so we can't put in a digital rectal examination. But let's just say for some reason, let's alter this and no lymphadenopathy. Well, we can click over here, but let's say we don't like any of these options. We're going to click on the text box, and we're going to basically add our own text to this. We'll say significant. This is just an example. Adenopathy palpated. And that's how a full physical examination looks. Okay, drawing. Honestly, I don't really generally use this. I'm not even sure if we have access to the image library right now, but you can potentially pull in different pictures. I'm not going to mess around with this right now. But if you want to do a full body anterior, you can, and it knows that's a female, so it pulls that in. There are ways to alter this. I don't generally recommend using this. Results. This section is important. What goes in this section? Anything that you do in the office procedure-wise. And everything that you do in the office is built to either add orders. 99% of them are in add orders or add order set. And what you're going to do is you're going to click on this add orders, and you're going to choose whatever is done. The biggest ones you'll see: biofeedback training of pelvic muscles, biofeedback first time with EMG, complex uroflow, duplex scan of penile vessels, foreskin manipulation if you reduce a paraphimosis. It's rare, but it happens. Some of the other ones that you'll frequently use, such as Lupron. Let's see. Foley catheter insertion, straight catheterization, ultrasounds, complete pelvic, partial pelvic, bladder scan, partial renal ultrasound, complete renal ultrasound, sacral nerve latency testing, suprapubic tube change, testicle ultrasound, Eurocuff testing, urodynamics with an injection, urodynamics without an injection. Those are generally the big ones, and they can be easily customized if there's another procedure that you're going to be performing in the office. And what you would do is you would click, let's say we did a urodynamics with injection, click OK, and you're going to see a little section over here. As you can see, all these procedure codes show up in this section. All right, we can write down some of the findings. There'll be a separate procedure note, but we can write down some basic findings here. Qmax, 16.8 cc's per second, no obstruction, normal EMG, normal compliance. And actually, there's only one line that you can fit in over here, so what you do is you click notes, normal compliance, and you can keep typing as much as you'd like, etc. Add order set. This is a little bit different. You generally won't use these, but just so you can see, if you click on BCG installation, for example, this will pull up a bunch of order codes, and you'll actually be able to pull in the different values of a urine analysis, and you will click on these different values. But other than BCG, you generally won't do this, and there'll actually be a BCG note under procedure note as well. Okay, so that's a results section. Anything that you do in the office generally gets billed under results, and this will pull in the correct CPT codes automatically, although you always have to check this on the super bill. Okay, assessment. All right, so on your template, you have these rather generic urologic assessment codes, both ICD-9s and ICD-10s. Okay, if you have any questions about it, sometimes I will give you some more information about each of these, but what you're going to do is you're going to choose the reasons why the patient is here, and we can rearrange these ICD-9 codes, ICD-10 codes to the way that you to the common ones that you normally see. So let's say we have this, and then they will always have some AUA symptom score. So you will always want to have some of these, most likely have some of these voiding symptoms checked. Okay. What happens if there's something that you don't see here? Well, let's say that you want a testicle tumor. Okay. You start typing in this box, and then you'll see something show up over here. It'll say testicle lump. Okay. And then it will show up at the bottom. So even if there's nothing in your template per se, and some people have blank assessments in their template for whatever reason, you can just type in whatever you want, and it will search for the right codes. All right, so there's 3 different buttons over here. The one on the left allows you to add a discussion. For everything that you click over here, you should add a discussion so that you or anyone who's reading your note, including the next provider who sees the patient, will know what was done for this patient. Okay, there's this button over here, and then this button over here. Okay, don't generally use this button. Use this one over here. So let me show you what I mean. So erectile dysfunction. We'll try sildenafil. Discussed risks and benefits, blah, blah. You can write a discussion for each one. Write a discussion for each one. Hold off treating. I'm just writing some generic things here. We'll follow up with Dr. Wren, our female voiding specialist. And make sure you write something for each of these. Now, generally, patients need problem lists. To add these issues to the problem list, you click this button right over here, and it will go directly to the patient's problem list. As you can see on the face sheet, the patient now has erectile dysfunction, and as we discussed earlier, it is bolded, which means it's on the problem list. So every patient needs problems. that's really a Medicare requirement, but it's actually also helpful for a practice. So if let's say someone else uses their own note, but they have their own assessments, they can basically insert active problems, and it will pull the problems into their note so that we know what the patient is actually here for. So I generally click on the right on all these things, so it adds them directly to the problem list. It's very important to do. Okay. Plan section. All right. There are many things on the plan section. The plan is essentially, so under assessment, anything that we're actually going to do for the plan, we actually put here. So we're going to say that we're going to we're going to do this, we're going to do that. This is kind of our narrative under the assessment. The plan is actually the action. This is how you actually get stuff done. Okay. You order labs, you order studies, you order medications, and you send tasks to arrange surgery. And you can also put pre-written little blurbs. Based on your template, it may pull in recommended order sets that you should consider. This is one way to do it. So for example, for erectile dysfunction, so I have a generic area over here at the top that has pretty much everything that I'll ever order, and I could just click through whichever ones I want, urinalysis, urine culture, etc. But then there's also, and then medications and things like that. There's also specific things, so instructions for erectile dysfunction, N5 2.9. So I will click what I want to say, and I can actually set this. So if I'm seeing patients with a lot of erectile dysfunction and I want to customize this, I can make it so every time I choose this diagnosis, it will have it will say these blurbs, and they will go right into the bottom of my note. Okay. Likewise, there will be recommended orders and medications. Medications for erectile dysfunction. Let's say I'm going to start sildenafil. Okay. I'll click over here, and you have to click through some of these warning signs sometimes. Make sure you read them. And then it will ask you for the dose that you want. So we'll say Q-Day PRM will give them 30 pills. Okay, and then that is it. You can see that you can modify this. You can take it out. You can basically give a drug interaction. You can check for drug interactions, that sort of thing. And medications for frequency, medications for and these are common medications. And as you can see, I have a special order set for erectile dysfunction also. For example, hypogonadism initial panel. Okay, and this is a nice way to customize what each ICD-10 code will order for you, and I can these can all easily be customized. Okay. However, so this is one way to do it. What I have also done is I've also developed order sets based on disease processes. So, for example, rather than click all these things, I have hematuria, new female, new male, and follow-up. I have dysuria panel. Use the anything in black is a panel. This green one you can ignore. I have BPH panel, BPH order set. I have testis cancer, which you use very infrequently. This one right over here. I have renal cell. Kidney tumor, I can't remember. Renal mass. Renal cancer follow-up panel. I can't remember if I have a prostate. That's probably just a PSA, so I may not have prostate cancer. Nah, just a PSA. I do have PSA full. Okay, for if I want to do a free and total rather than click on both, I can just do order PSA full. And I can do a, what else? I said dysuria, PSA full, stones. Pretty much anything I would order for stones. So in our example, let's do hematuria, new patient, male. Okay, and what is this going to order? This is going to order me a urinalysis, urine culture, PSA, cytology, FISH, BMP, as well as a CT urogram. Okay, it is unfortunate. A lot of times, some of the orders, there are redundant orders, but they don't always link to to our laboratories, like such as LabCorp, or imaging facilities such as Atlantic Medical Imaging. So I try to update these um, to make it so that the ones that you order are the correct ones for you that you can use. And I'll show you what I mean in a little bit. So let's say I also, if I want to add medication, I can click over here and choose add order from favorites, add order from search, add order from prescription, add instruction. So let's say, let me just show you add favorites. Imaging procedures, if I wanted to click through them, that's another way to do it. I almost never do it from here. Same thing with labs. Surgical procedures you can pretty much ignore because you're not going to order surgery here. Add order from search. I can search for anything over here. BMP. Maybe just click that. Add order set from search, which I showed you, like the dysuria panel. Add new prescription. Let's say we want to give her, I don't know, aspirin. Click aspirin, 81 milligrams. Choose a reason. We'll choose nocturia. Not very good indication. We're going to do 1 pill. Wait required to conduct dosage screening. You'll get lots of warnings. So we'll give her 90 days with 3 refills. We'll click OK. Boom, the patient has aspirin. We want to leave an instruction. Don't take aspirin. And we can add another, or OK, or cancel. And that adds instructions to the bottom of the note, somewhere over here. There. And we can actually add more instructions over here. Okay. Another place is down here by the medications. We can add prescribe new medications, insert active medications if the patient's already on medication. Let's say the patient's here for refills. We would click insert active medications. And then we would actually click, let's see, these previously given doxazocin. So we can give refills, we can change the dose, or we can stop. Let's say we're going to stop. We're discontinuing the doxazocin. That gets crossed out. Okay. Well, let's prescribe. If we prescribe new medication over here, so you can prescribe by name, you can prescribe by indication. We also have favorites. And we've categorized these. We can easily add things to this. So, for example, kidney stone medications, we have potassium citrate. Skin disorders, if patient needs here for dermatologic issues, it's nice to not have to look up those doses. We have an IC protocol. We have diallergy protocols. Of course, we have alpha blockers. Let's say we want to give an antibiotic. We're going to give Bactrim. Typical 7-day course. We'll click there. Once the number of days, we'll click there. We'll just click cancel there for now. All right, and it's always important to know, so over here, you can always see a preview of your note, and this is essentially what the note looks like thus far. Okay, and as you can see, everything that we put in, this is our history. It looks a little funky because we drew over here. Normally you don't draw and you don't see this box. Past medical history, we did a basic medical history. Review systems, we did a complete review systems. We did a complete and thorough examination. We actually did a figure, which we did a drawing. We did results, so we have results of our urodynamics as well as BCG. Assessment, where we have what the patient's assessment is as well as the plan in each of the boxes. And we have orders. We ordered, basically, we decided that we're going to actually do a hematuria workup on the patient. And we started aspirin as well as sildenafil on the patient. And then we have little blurbs, pre-written blurbs that we put in for erectile dysfunction. So it's kind of a schizophrenic note, but you get the gist. Another thing I should mention is throughout the visit, you may want to click save and hold charges so you don't lose any of your work if something happens. Always save and hold charges. And for some reason, it's taking a little bit longer. Okay, there we are. And then you're going to want to add in so the patient's going to come back in a week. Okay, if you're not happy with the choices over here, you can always just click return visit request. And you're going to click 2 days. Okay, then we'll unclick the 1 week. CC. So we want to send this to someone. You need to make sure that this is checked and that a CC is in here. We're going to send this to this person. Okay. So if this is checked and this name is here, we can send this note, we can forward this to our transcriptionist to have this faxed out. All right. So that's the gist of our note so far. Now we have to send our orders and prescriptions. All right. So we're going to. So if you see, after we hit saved and hold charges, we had a couple new buttons pop up. We have this print RX and send RX, as well as orders requisition. Okay. So first, prescribing. Print RX, send RX. In general, you should, let's just send one of them. In general, you should e-prescribe everything. Generally, the kiosk will ascertain the patient's pharmacy, so you don't have to put this in, but for purposes of demonstration, I'll show you how to do this. If for some reason the patient just wanted the prescription printed, you can just click here and choose your printer. But we're going to send e-prescriptions, and we're going to choose a pharmacy. We're going to click on this globe. Let's say we're going to send it to Target in Mays Landing. Oh, I think now there's CVS Target, actually. Yeah, CVS in Target. We're going to click this. We'll add that to his preferred pharmacy. We're going to click select. We're going to double click over here and make sure that's clicked. So now this is highlighted. This screen tells you where you're sending your prescriptions. So in this case, aspirin is going to go to Target, CVS and Target. Sildenafil is not going to go anywhere. We're going to click OK. And then this is our final screen. When we click prescribe, it's going to go over. All right. For our purposes, we're going to leave it as is. We're not going to send it. Okay. And I think, see an earlier video, I show you how to check that it's actually been sent underneath the prescriptions menu over here. You click over here to medication list, and you can actually check these are the patient's medications. Prescription action will show you if it's actually been sent over. It will show up that it's been sent. All right. So back over here. So that's how you send your prescriptions. Now we're going to send orders. This is a little bit trickier. Hopefully this wants to work. There we go. So we ordered a whole bunch of stuff, and it all needs to go to different places. First of all, you need to make sure that the ICD-10 code is associated with the orders, and you see a check mark. The easiest way to cheat is to send everything to the printer, and in some cases, you'll need to do that. Okay, if for some reason the patient isn't going to go to a lab, or the patient just wants to take this to Florida with them, you can click everything out on a particular sheet and just click print. Send everything to the printer. Open up this orders requisition, and then you are going to see a PDF pop up, which you can then send to your printer. And this is essentially what it looks like. All right, you would give that to the patient. However, we strongly believe in bidirectional ordering. It decreases variation and improves the accuracy of receiving results and speed of receiving results. So for each of these, we're going to determine where they go. And as you can see, the first 6 are labs. The 7th one is an image. So we're going to click on each of these to determine where they're going to go. So we're going to cheat a little bit. We're going to send them all. So generally going to send things either to the printer, to Quest, LabCorp, or AMI. LabCorp is the big lab around here. So you're going to click LabCorp. So they're all now going to LabCorp. The CT urogram we're going to send over to Atlantic Medical Imaging. Okay, and as you can see now, that one's going to Atlantic Medical Imaging. All right. One problem here, a cytology currently in 2016 goes to a separate area of LabCorp than the rest of the labs. So for the time being, you have to add in one extra step, unfortunately, in sending labs. We are going to send this cytology separately. We're going to send that to none. All right. We are now going to submit everything with a green check. We can now submit over to LabCorp. Urinalysis, urine culture, PSA, cytopathology, and BMP. I'm going to click submit, and then the next screen is going to show up. This sends it through a third-party interface called MDON. We're going to click this validate order. It's going to ask you some questions. Usually it's going to be very simple. If they're asking if the patient needs to fast, we're going to say no. We're going to print and send. This is the requisition, how it looks, and it goes automatically with a nice little barcode at the top. And then we're going to click print. Okay. What this has done is this barcode is specific to these orders. When the patient takes this barcode over to LabCorp, they will scan it, the labs will get done, the results will automatically get sent into our electronic health record systems as they're available without human intervention. This greatly decreases error. Likewise, they're sent electronically. If the patient loses the sheet, they should be able to go to a LabCorp, they'll be able to pull up their name, and this particular requisition number will go with that patient. They'll be able to do these labs. Okay? And now you can see that these labs are now grayed out, which means that they have been sent. Now, unfortunately, we have to go back to the cytology. We have to send this separately also to LabCorp, so we're going to do that quickly. Just click Submit. And same thing, it's going to ask a simple question. We're going to click Save. We're going to print and save. It sends it over. We're going to then print it. A separate barcode, a separate requisition number. Now that's sent. Okay. Finally, Atlantic Medical Imaging, we're just going to click Submit. It does not go through third-party interface. It just goes over directly. Now let's say if for some reason we forgot to print something, we can just click over here and print. We can click which ones we want to print. We'll click OK. It will load up the PDF. And then we can just print it all out then and there. And then it will have a slightly different barcode, but it will still have the requisition number. I believe, yeah, requisition number for that one. Requisition number for, let's see, none for the CT urogram, another different requisition number for the cytology. And that's how you send labs over. Okay. And let's say finally we want this patient to have surgery. We are going to set up a task. Surgical scheduling, we will say, let's say we want this patient to have an awake cystoscopy, and we looked at our calendar to determine when the cystoscopy, when we can do this. We're going to say it's a new task. We're going to say that it will be with, let's see, Friday, August 5th at EHT with Todd Jerry Lehrfeld. Follow-up PA 2 weeks. We'll then click Save and Return, and this will actually come into our notes. So our referring doctor will also see that, that this patient's going to have a cystoscopy. In our case, this is a test. I'm going to delete this task, and I'm going to go to Canceled. Okay. Finally, once we're happy with every section of our note, we're going to go to E&M. I implore you to study E&M and to review our E&M lectures with our compliance officer as well as online. Suffice it to say, there are different codes that need to be used. It's a little bit beyond this lecture, but in our case, let's say this patient this patient is a new patient who has an insurance that does not allow us to do a consult. A consult, if a patient, make sure you know who can get a consult and who can't get a consult. If it's a consultation, you would use this. If it's a new or patient who can't get a consult or an established patient, you'll use outpatient services. If it's a new patient, we'll click over here for yes, it's a new patient. In general, is this focused primarily counseling or coordination on care? Generally, you will not use this unless you have a very long meeting with someone. Then you will want to build based on time, but generally you will not do this. And then you determine your complexity. Erectile dysfunction is a new problem, will require evaluation. Actually, all these problems are, but we'll say we already know about the testicle lump, even though I didn't put that in my note. And then you need to understand, after you choose everything in the E&M, you need to understand the risk levels. And this takes time to understand: low, moderate, high. So moderate, we're going to fit in this because minor surgery with identified risk factors, we meet it just for this criteria. And we're going to click moderate. We reviewed labs, we reviewed radiographs, and we actually looked at the pictures ourselves. As you can see, this brings our complexity level up to a high level. In this case, will be a level 5, which is a very high level. It's actually very rare that you will do a level 5, especially for a new patient. But this is what it scores it as. And please, this takes some time to get used to, but please spend some time understanding your billing, because although Greenway will do it for you, you really need to have a high level of understanding of how billing is done. All right, so we click calculate. If you want to see why you got what you did, well, this is essentially a carbon copy of the CMS documentation on how to code billing. So history of present illness, we have extended, we have 6 elements documented. Review of systems, we have a complete review of systems. PFSH, we have a complete PFSH. And as you can see for the history summary, we got extended, complete, leads us to comprehensive. Physical examination, we have 12 systems, 25 bullet points, which is actually overkill. But that gives us a comprehensive exam. And then complexity, as we went over in the calculator, why we got a high level complexity. All right, now we're going to save and sign this. Are we happy with this code? It senses, it actually senses that this patient has been seen before, and maybe we can't bill a 99205, i.e. a new patient, but we should bill a 99215. We're going to go ahead and agree with what we initially said, even though the computer's right. This patient has been seen before within the last 3 years. We're going to click yes. Okay, it's going to save and sign the note, and it's going to pull up our billing summary. Okay. So this is our super bill. What goes on this form is what gets submitted to billing. Make absolutely sure that you are happy with this bill. Make also sure that you see a visit up here. Earlier, we set up a flag that in our user settings that said that it will warn you if a visit is not linked. If you don't see a visit number up here with the date, that means your visit is not linked and your charges will not get submitted to billing. So make absolutely sure that you see a visit ID up here. All right, so we're going to go through these CPT codes. 99205 we agreed with. Some of these other ones, well, you see an exclamation point. We need to match what goes with these. One way to do this is to map all diagnoses. But in our case, we're going to take the extra minute and do this correctly, because for the urodynamics, which we don't generally do during office visits, but we're only doing for this demonstration, erectile dysfunction does not match to the CPT codes for urodynamics. So in our cases, we're going to do the voiding codes. So for each of these exclamation points, we're going to match in the voiding codes. And sometimes it can be a little tedious, but again, usually you don't do procedures. We'll just choose that. Usually you don't do these procedures when you're actually seeing the patient. That would be a separate testing visit, and then you don't have to do all this clicking. But for our intents and purposes, we want this to look pristine for billing. All right. So we just about have all these billing codes. And in our case, we did BCG. None of these codes will actually get us for BCG. You need a bladder cancer code or a CIS code to really hit BCG. But again, since this is a test patient, we're just going to put in some fake codes. So we get all green checks. You want to make sure that everything that you bill has a green check. If you don't see a green check, that means it's not going to billing. If you see an exclamation point, you need to put in a code. If you see this dash, then for some reason, your code did not go through. Now, why didn't it go through for this? Well, BMP, CT urogram, we're not billing these. These are orders. We shouldn't bill them. So you'll see some of them will say a charge, but again, there's not going to be a charge. All right. If there's not a green arrow over here, it says it's not billable. All these other things that when they say ready, you'll see a dollar amount that we charge for them, as well as a green arrow. You know you're set. Okay. And you'll click save. One other thing I didn't quite touch on in this lecture. Oh, and then another thing you're going to do. So then you're going to route this document, route it to transcription. And you're going to say, please fax. You're going to click OK. If and again, you may need to make sure that the CC is in the note. Otherwise, you're going to get a task back asking for the CC. If for some reason the doctor's name is not in the database, you can actually say, please fax to Dr. Smith in Berlin County, New Jersey, and try to give them as much information as possible, then they'll add them to the database. Then you click OK. In our case, again, this is a test patient. We're going to click Cancel. One thing we didn't touch on is while I'm actually seeing the patient, I'll have my appointment scheduler up, particularly if I'm not scheduling surgery, but I'm making an appointment for the patient, and I will make, I can have this going. Let's say I want the patient to come back and see a physician assistant in 2 weeks. 2W. Here's all my physician assistant appointments. I'll have them see Megan on 9:45. I'll type in Y, review tests, and I'll click over here and then make the appointment. Whichever patient is over here, you need to make sure they get pulled in over here. You'll see their name over here. You can choose their appointment. Okay, so I will schedule as I'm doing my note. Let's say if I wanted to add something to the note, after I already saved it, you just click Amend, and you can add whatever you want. I'll just click Erectile Dysfunction, and I'll click Save and Sign. Okay, and then it'll again give me the billing summary. We already reviewed that. All right. Overall looks good. All right, so we are now done with this patient. We will go back. We'll click on Greenway flag to go back to the main menu. We will then right-click on the patient. We will click Checkout. A lot of times, the kiosk attendants will check the patient out as the patient leaves. Let's say we check the patient out by mistake. You can right-click. You can do Undo Checkout. And that is in a nutshell of how we do a basic office clinic, a basic office visit for a patient.